morning, everyone. Thank you so much for joining me. We are talking today about supporting children and adolescents online. And as a DHA licensed psychologist and play therapist, my mind goes back to 2022 when COVID hit and we all shifted online. And my main big question was, so how do we do it? How do we engage children and adolescents online in such interventions as play therapy and counseling? So today I just wanted to share with you my experience, what I've learned, what I know, and some resources that I've come across in my practice, in case you'll find it helpful for your practice too. Okay. So I work at the Wellness Hub. This is psychology and holistic wellness clinic based in GLT, and we support children, couples, families, technically anyone of any age. I always say we work with babies also through their parents, because it's usually the parents who need support at the time. So any age. We deliver psychology sessions, individual psychology, couple therapy, parenting support. Children and adolescents we work with also. In therapy, we see children starting from 3 years of age, and this is for play and art therapy. Now we've just added Zen play therapy as an independent intervention, which I love so much. We offer support groups, and there's many skills building programs. And we teach, we have a big team who delivers trainings in different languages, including English, Arabic, Russian, Ukrainian, and we deliver trainings and webinars to parents, teachers, mental health professionals, or to corporate companies. So, getting that out of the way, online counseling and play therapy. What's the plan for today? The plan for today is to talk about key guidelines for delivering online counseling services. I will do my best to bring in and talk about best practices for working with children and adolescents in virtual settings, and share tips for maintaining engagement, safety, and ethical standards online. A big part of today is sharing with you the resources of what actually use with children of different age and adolescents to practice. And I will have 15 to 30 minutes. And if I may kindly ask you to mute yourself, that would be amazing. Thank you. And there'll be about 15 to 30 minutes for our check-in and question and answers, our engagement. And that's when the recording will be switched off and we'll have that space to share and connect. So let me start with exploring with you a little bit about how do you feel about technology. So technology and I, which 3 words would you choose to describe yourself as a counselor? Without thinking about technology, just take a minute. If you can type it in the chat box, you can just write it down, you can just have that in your mind. Which are the 3 words that you would use to describe yourself as the counselor? And it can be an adjective, it can be a noun, it can be anything that comes to mind. And once you have these 3 words, just leave them aside and think about technology. What is the first feeling and association that comes to your mind when thinking about digital technology and technology-based counseling? Think about just one word that could summarize this feeling or association. And again, type it in the chat box or just keep it in your mind, whatever is easier. Okay, thank you. Someone is typing. Thank you. Okay. Right.
Yeah.
Patient, understanding, available, good listener, empathy, available. Right. Support systems, non-judgmental. Okay. And one word that comes when you think about technology, what's the association? And here, I'm sure we'll get different responses because for some people, technology is associated with connection, access. For other people, probably like myself, it's associated with anxiety. Is it going to work? Will I know how it will work? And so on. So, in reflection on this, I just want to check, yes, opportunity to connect with students in a better way, you see? So, we all are so different with this. And bearing in mind that one word that you have associated with technology, think of your original three words as how you described yourself as a counselor and see if these three original words change or remained the same if you were to deliver online counseling. Right? So, is there anything that's changing in you as the counselor when it comes to online delivery, in other words? And I'll open to see some more answers. Okay, the person who can help to understand the problem, find the solution. Okay, so the idea about this little exercise, behind this little exercise, is to see and to feel your comfort zone and to see how technology impacts your identity as a counselor, impacts your skills as the counselor. And again, it can go, well, obviously more than two ways, but the main two different ways that come to my mind is you can either become more grounded because maybe you're more comfortable delivering online, maybe it takes less energy, maybe the tools that you are using and the age groups that you are working with more suitable for online delivery, or it could also be that it's, as I said, anxiety provoking, as for myself, for example, because working with 3-year-old, 4-year-old, 5-year-old online is a very different type of work. And that also, that online delivery changes my identity as a counselor, as a psychologist, and maybe some of yours also. And it's good to be aware of that because we'll all have feelings when we do online counseling when it comes to technology. I think the problem comes more when we ignore those feelings or are not aware of those feelings and just keep trapped, like for me in my case, in that anxiety, right? So if I were not to acknowledge that certain things make me anxious, I would not be looking into the ways to overcome the anxiety, to understand what it is about it that makes me anxious, to learn new skills, and so on. So the idea is the awareness of how we feel. So let's look a little bit on online counseling. And this is perhaps common sense, but I would love to start with this just to bring us on the same page. So clearly there are differences and there are similarities between the counseling itself. So what's the first difference that come to mind? Usually it's a physical space, clearly, right? So within the physical space, if you are online, if you as a therapist based online, and if you have to deliver, especially the counseling services from home, it's that personal and professional lives merge. It's where my personal life ends and my professional life starts, and how am I going to manage it? How much of my home am I sharing with my students and or clients, and how much are they in a position to share, and how it affects our therapeutic relationship and counseling itself. So privacy and confidentiality is a big one here, because when they come to your office, if you are based in school, you are more or less in charge of the environment. Yes, of course, someone will knock on your door, I'm sure, during the session, and there'll be people coming in and out, but you are still expecting certain things. While you're at home, you have your own family, you have your perhaps own children, you have your own things going on in your life, which are not always possible to manage and control in the same manner. And this goes for our clients, students as well, because parents might be walking around, perhaps helpers or nannies or siblings. So privacy and confidentiality becoming a big area here to manage for us. And with that, it's also a big power shift. So the sense of control is being shifted. You know, the first thing that I remember about COVID, when I worked with a 5-year-old girl, I believe she was 5 at the time, and she was defiant and oppositional. So there I prepared all my stuff, was ready to engage, and she just closed her screen and I was shut down and fully disconnected, right? So the child or adolescent has so much control also over whether they engage with us and how they engage with us, how the session starts and when it ends and how it ends, right? And also the power shift goes um, for parents also, right? Because parents have more accessibility to what we are doing online, and that we are not always aware of it. There were many situations in my professional experience where, you know, I would be working with a child and then they would be looking somewhere like that. And I was sure, and we spoke with the parent that it's their time and space, and the parent would be just there checking, you know, maybe if everything is okay, maybe checking what we are doing and so on without informing me and asking, and without asking the child to inform me that the parent is there. So it's a huge power shift in how we work. And of course, information access, right? So it's limited visibility of the body language. Right now, you see me, just half of me. For many of you, if I wanted to check, your cameras are off. I don't know who am I talking to, and are you alone in your space? Is someone else is listening? Are you listening? Are you multitasking and just, you know, listening to some parts of what it is I'm talking about? Many people tend to not be fully dressed, right? Like formal top and something very comfortable like shorts down. So because of that limited visibility and body language and the environment, we do not get full information of what we are dealing with. And the same goes for our clients and students, right? They don't know. So you just have a snapshot of me, of myself, and I'm doing this from home today just to get into the feel of that online counseling. In the office, it's a different feeling also. And of course, on the other side, there is more information because we get more information about each other's environment, right? So you do see what the bookshelf looks like in my home. And with the kids, you will see where they are, what their rooms look like, where is their, if they are doing the session from studying place, or are they just in bed, or what are the surroundings, right? There's more information. With adults, sometimes in adult session, I would mention this, although it's not directly related, I think it just illustrates my point a little bit better. We had clients who, you know, would come in their pajamas or would be taking the session from the bathroom. This is the only place where, you know, they can have privacy and without kids or anyone in their space. So all sorts of stories come up, and this affects how we engage. It affects the process. It also affects our note taking and documentation. How do you usually take notes after you've seen the child? Where do you store them? Do you write by hand and anonymize this? Where do you keep that piece of paper? Do you really have a locker in your home if you're working from home to put that in? Or do you just anonymize it and leave it somewhere around? Does anyone have a chance to see that? Are you storing it in your computer? Do you do password protected files? So all of those questions would come up, right, with confidential storage and anonymized notes. So these are the differences. But what are the similarities here? So the similarity is that our counseling intention for the session, counseling session, and the goal is support. We want to support the child. We want to support the adolescent. We want to support that family. So that intention is there. And it does require skills to achieve our goal, right? We still need to be present. We still need the skill of active listening, engagement. It can look differently, and it can be a variation of that, of those skills, but the skills are still needed for that. It is still, we still, as counselors, we still create space for sharing and connecting. So, but how is different, because think of your office. Office is a physical representation of the container, right? It's a container where you hold the child, where you hold the adolescent in your space. So it's probably calming space with some tools, with some emotional expression charts and so on, right? So the space in your office is the holder. But how do you hold that space online? And how do you create that space from your home to hold and connect? The space is needed, it's similar, but how it's done is different. We will still see emotional and behavioral patterns from our clients, students, and it will be presented online, but it will be presented again differently. What's similar here also is that we need to manage emergency and disclosure. How we manage it, again, is quite different. And I'm just bringing this up here and I will get to the point how. Just bear with me. So as I was thinking about these differences and similarities, I came up with this triangle. We have differences, we have similarities, we have client. And I was thinking this base of the triangle, right? For me, the way I see it, it's still the therapist that holds and enables all of this triangle to come together, right? It's still the foundation is still the therapist and therapeutic relationship. And I feel, and you may agree or disagree with me, that we sometimes, or some of us, may tend to forget that the core of the change for the client, for the student, starts with therapeutic relationship. I think sometimes we get so much involved into intervention or the rest of the skills, which is again very important. I'm not trying to say that it's not important, of course, but the therapeutic relationship is essential. You know, without the therapeutic alliance, without the client to trust you, to connect with you, that intervention will not come through, right? So I think even with online counseling, no matter how you feel about technology and engaging and whatever you think about delivering and the effectiveness of online engagement, it's worth remembering that therapeutic relationship is the foundation and the core, whether we are online or offline. So these are the playrooms from our center, right? On the left, you see the Zen Play Therapy room. On the right, it's our playroom. And these are the rooms. Usually, this is how our rooms are set up generally at the center through, I mean, maybe past 15 years of my professional experience, similar to this, right? So suddenly, when I don't have all of this, and these are my tools to engage with the child, it's my tools to connect with the child, and I'm left with one screen and seeing half of the body of them and myself. That's what's different, right? It's so how do I work with that only? So when it comes to online presence, there is a lot of visible things and many invisible, and I would say more invisible than visible also. Is online counseling harder or easier? Well, it would depend on your comfort zone and preference. For some people, they feel it's taking less energy because you're home, you don't have to put that energy into the commute to go, but it could be more stressful also because you might be wondering, how do you engage coming from here to this one screen? How do I engage? How do I make it effective, right? It would depend on your skills with technology, which will be quite a big one also. And I think this is also perhaps not just the personal preference, it's also the age. From my experience, I see the younger counselors are more comfortable. It's not as it doesn't put as much strain perhaps on this technology part itself on their work rather than someone, well, I would say my age or older than me. It's a different generation and it could be a little bit more difficult. Age group you are working with, of course, if it's 16-year-old, it's still very different work to a 3 or 4-year-old. Our expectations from our online services, from our delivery of online counseling. It depends on our willingness to learn and be flexible and home situation. Home situation also, me having, for example, two small kids and doing their schooling online learning, right? And there's something I cannot control. If people hear them screaming somewhere around me, this is not something that's easily controllable.